Diabetes and stroke. Please subscribe to my YouTube channel SDK Online Teaching Institute. What is the link between diabetes and stroke? Diabetes means you have too much sugar in your blood, and this can make you more likely to have a stroke. This is because having too much sugar in your blood damages the blood vessels. It can make the blood vessels become stiff, and can also cause a buildup of fatty deposits. These changes can lead to a blood clot, which can travel to the brain and cause a stroke. Who is at risk of diabetes? Type 1. You're more likely to develop type 1 diabetes if you have close family members with the condition. Type 2. This type of diabetes is strongly linked to being overweight, but you can also get it if you are a normal weight. You're at higher risk of having type 2 if you have a close family member with the condition. It's more likely to start over the age of 40. It's also more common in people from African and Caribbean, South Asian, and Chinese ethnic groups. If you are in a high-risk group for type 2 diabetes, ask your pharmacist or GP about having a health check. Symptoms of diabetes. The main symptoms of both type 1 and type 2 diabetes are being very thirsty, needing to pee more than usual, feeling very tired, unexplained weight loss, often having thrush, cuts or wounds that heal slowly, blurred vision. Many people do not realize they have diabetes because it tends to develop slowly. Some people are only diagnosed after they have a stroke. Diagnosis. Diabetes is diagnosed by a urine test and blood tests. You might have a blood test which checks how much glucose is in your blood. An HbA1c blood test shows your blood glucose levels for the last 2 to 3 months. A glucose tolerance test, GDT, checks your blood sugar before and after drinking a sugary drink. Prediabetes. Type 2 diabetes can develop over many years, and your blood sugar can rise gradually. If a blood test finds your blood sugar is higher than normal, but not high enough to be diagnosed as diabetes, you might be told you have prediabetes. Many people can stop this progressing by making some lifestyle changes such as losing weight and being more active. Ask your pharmacist or GP for advice. Gestational diabetes. Gestational diabetes is a temporary condition during pregnancy. It usually stops after the baby is born, although it can increase the mother's risk of developing type 2 diabetes in the future. Managing your condition. Patients with type 1 are referred to a specialist care team. They need to take insulin for life, and they need to manage their diet and exercise to stay fit and active, and keep their blood sugar stable. If you are diagnosed with type 2 diabetes, you should have help from a team of health professionals including your GP. You will have advice on your diet, foot checks from a nurse or foot specialist, and eye checks by an optician. You should have your blood sugar level checked at least once a year and your blood pressure should be monitored. Managing type 2 through diet and exercise. All diabetics need to stay active and eat a healthy diet to stay fit and well. For type 2 diabetics, it may be possible to achieve a normal blood sugar level by losing weight and being more active. But don't stop taking any medication without speaking to your doctor. Along with treatment, you should get help and advice with making lifestyle changes. Medication for type 2. Many people with type 2 need medication to help them control their blood sugar. Metformin is the most commonly prescribed medication. If this doesn't bring your blood sugar level down enough, you will be offered another drug or combination of drugs. It can take time to get the right medication or the right dose. Talk to your GP or pharmacist if you have any questions or concerns about your treatment. Metformin. This is the most common medicine given for type 2. It helps to lower your blood sugar levels by reducing the amount of glucose that your liver produces. It also helps your body to respond better to the insulin that it produces. It is usually given in a low dose to start with and gradually increased, to avoid stomach upsets. It's available in different forms such as modified release tablets. Sulfonylureas. This type of drug works by helping your pancreas to produce more insulin. It can lead to low blood sugar, hypoglycemia, and side effects including nausea and weight gain. There are a number of different sulfonylureas including glibenclamide, glympyride, gliclazide, tolbutamide, and glipizide. GLP-1, glucagon-like peptide-1 receptor agonists. GLP-1 agonists are given by injection and boost insulin production when there are high blood glucose levels, reducing blood glucose without the risk of low blood sugar, hypoglycemia. They include glepaglutide, exenatide, liraglutide, and lixisenatide. Pioglitazone. Pioglitazone is a type of thiazolidinedione medicine, TZD, which make your body's cells more sensitive to insulin so more glucose is taken from your blood. It's usually used in combination with other drugs. It can lead to weight gain and other side effects including bone fractures and increased risk of infection, so you should be reviewed regularly while taking this drug. SGLT2 inhibitors, sodium, glucose cotransporter 2. This is a new type of drug for type 2 diabetes. It works by increasing the amount of glucose excreted through your urine to reduce the amount of glucose in your blood. Examples include dapagliflozin, canagliflozin, and empagliflozin. Gliptins, DPP-4 inhibitors. These drugs prevent the breakdown of a naturally occurring hormone called GLP-1, which helps the body produce insulin when blood sugar levels are high. Gliptins keep levels of GLP-1 higher in the blood to help reduce blood sugar, but without causing low blood sugar, hypoglycemia. Examples include alogliptin, linagliptin, sitagliptin, saxagliptin, and vildagliptin. Other medications. Less commonly used medications include Acarbose, which slows down the rate at which your digestive system breaks carbohydrates down into glucose. It's not used as much because of common side effects like diarrhea. Meglitinides, nateglinide and repaglinide, are taken just before eating, and stimulate insulin production. They may help people with irregular meal times. Insulin injections. Insulin can be used for type 2 diabetes if other medicines no longer work. There are different types of insulin treatments available. Your care team will talk to you about the type of insulin that they think is best for you. They will also teach you how to inject yourself and help you with any concerns you may have. Type 2 diabetes diagnosis after a stroke. For some, diabetes may make very little difference to their day-to-day life, but for others it can have a big impact. You may find that you need to change your diet, take medication, and monitor your blood glucose levels frequently. Some people are only diagnosed with diabetes after they have had a stroke. Coping with this as well as the effects of your stroke can be tough. You may feel a range of different emotions about having diabetes. It can take time to adjust to the demands of managing your condition, and it can be easy to feel overwhelmed. But try to take it one step at a time. Speak to your GP about how you are feeling. Don't wait for your annual check. Don't be afraid to ask questions. Medical professionals are there to give you the information and support you need. How to live well with diabetes and reduce your risk of stroke. Stopping smoking. Smoking doubles your chance of having a stroke, so it's well worth getting advice on giving up. As soon as you stop smoking, your stroke risk starts to go down. Eating a healthy diet. Having a healthy diet is a big part of blood sugar control, and it also reduces your risk of stroke. Eat lots of vegetables and fruit, and have homemade food if you can, as it usually has less fat and salt than ready meals and snacks. Cutting salt can help with controlling blood pressure, and eating less fat can help with weight loss. You should get advice from a dietitian or through a diabetes education program. Ask your GP for advice. Moving around more. Being active can lower your blood sugars, so try to move as much as you can. Try walking for half an hour a day. If you can, try to keep moving at home too. Just walking around the room every 20 minutes can lower your stroke risk. If you are taking insulin or have very high blood pressure, it's important that you speak to your GP before starting to be more active. Managing your weight. Staying a healthy weight cuts your risk of a stroke. It also lowers your blood sugar levels, so if you need to lose weight, ask your GP. Drinking less alcohol. Regularly drinking too much alcohol can raise your risk of a stroke, and the calories in alcohol can also make it harder to lose weight. In the UK, the government advises that to keep health risks from alcohol low, it's best to have no more than 14 units a week, spread over at least 3 days. That's the same as about 7 medium-sized glasses of wine, or about 6 pints of beer. The limit is the same for men and women. Talk to other people. You may find that speaking to other people with diabetes is a good way of getting help and support. Diabetes UK runs local groups and care events that give the chance to meet with other people and find out how they are coping with a similar situation. Please subscribe. SDK Online Teaching Institute.